Acid reflux and heartburn natural remedies. Here is a list of natural remedies that you can use when you have acid reflux or heartburn. No need to use antacids, which have unwanted side effects and contain aluminum, which has been associated with senility and Alzheimer's disease. Anise, peppermint, and lavender. Here's a tea that you can make to help you with acid reflux or heartburn. It will help you reduce the amount of acid you have in your stomach. Mix together equal amounts of aniseed, peppermint and lavender. Make an infusion of this tea. Boiling 2 cup distilled water. Pour this water over a teaspoon of the herbal mixture. Let this tea sit for 3 to 5 minutes. Strain the tea and add a little bit of honey if you like. Place this tea in a thermos. Drink up to 8 ounces in the morning and 8 ounces in the evening to get relief of acid reflux. Aniseed or anise is a powerful herb that helps in digestive conditions and has many other benefits for your body. Use only the ash-colored anise called green anise, European anise or sweet anise. There are 2 other types of anise, star anise and caraway, which should not be used here. Peppermint is another powerful herb for stomach conditions or heartburn. It helps in digestion, stomach distension, cramps, ulcers, and gas. Lavender, known for its scent, has enormous healing activity for your body. Is also an excellent stomach aid. It is useful in reducing acid in the stomach. Betaine, pepsin, and papaya digestive enzymes. As you get older, your stomach weakens in its ability to produce hydrochloric acid to digest protein. It is undigested protein that leads to acid reflux or heartburn. Use digestive enzymes that contain betaine, pepsin, or HCl with each meal to make sure you digest all of your protein. Papaya digestive enzymes, which contain papain, are also excellent for protein digestion and you can use them with each meal. Use 500 mg or more of papaya enzymes per meal. Pineapples. Pineapples are a storehouse of enzymes and contain bromelain, an enzyme that reduces protein. Pineapples support digestion, reduce inflammation, and supports wound healing. The fresh juice has a high level of enzymes that will help you stop your acid reflux. You can also buy bromelain as tablet and take 200,500 mg per meal. Chicory root. Chicory comes from a family of bitter herbs that contain endive and escarole. Boil 1 cup of chicory root for 5 to 10 minutes. After it colds to room temperature, drink this tea to correct acid reflux or heartburn. Adding these herbs to your salad will also have benefits in preventing acid reflux. Eating those foods that are alkaline is the best way to avoid acid reflux and heartburn. Using the remedies listed here will give relief from your acid reflux. But more importantly, add a salad to your diet every day and you will have less acid reflux in your life. Facebook, Twitter partager. If you have acid reflux or heartburn, using natural remedies to rebalance your stomach is what nature intended. Listed are 4 natural remedies that you can use to rebalance the acid in your stomach. Cinnamon. Cinnamon has many medicinal uses aside from being great for various pastries. It has an antiseptic effect and has been historically used for colds and flus. It has fighting power against Candida albicans and has the ability to settle acidic stomachs. Here's how to use cinnamon for an acid stomach or heartburn. Toast raisin bread. Butter the raisin bread. Sprinkle cinnamon on the bread. Sprinkle cardamom on the bread. When you eat this toasted bread, chew slowly and completely before swallowing to allow the digestive juices in your mouth to start breaking down this food. Cardamom, which is found in India, has been used successful in treating celiac disease, which is an intolerance to gluten found in most breads. Grapefruit skins. Here is a way to settle your acid reflux stomach with grapefruit. Use only organic grapefruit for this remedy. Here's what to do. Grate the entire outer skin of an organic grapefruit, spread them out on a flat dish to dry, allow them to get crinkly dry, store them in a glass jar or Ziploc bag. Whenever you get an upset stomach, acid reflux or heartburn, start chewing and eating these strips of dried grapefruit. These strips will settle out your stomach. Eat only a few of them and test to see how many you need. Romaine lettuce. Romaine lettuce can be used to eliminate an acid reflux or heartburn condition. This lettuce is high in minerals and is highly alkaline. Here's what you need to do. Buy an organic romaine lettuce head, wash in distilled water, cut up the leaves and place them in a blender, add cold distilled water to make a slurry, add a slight amount of honey to give it taste. Drink of 4 to 8 ounces to get relief from your acid reflux or acid stomach. Mace, nutmeg, and slippery elm. Here is a natural remedy that uses mace and nutmeg, which has a history of treating indigestion, acid stomach, heartburn, acid reflux, stomach gas, and vomiting. Here's how to use it with half and half and slippery elm root herb. Slippery elm herb can be purchased in any herb store in powder. 1 teaspoon of slippery elm bark, a pinch of nutmeg, a pinch of mace, add distilled water to make a smooth slurry, heat a pint of half and half to boil, pull half and half from stove and add herb slurry, stir in herb slurry. Allow this mixture to cool. Drink up to cup at a time. Store the unused portion in the refrigerator. When drinking the next cup, warm this mixture up. Acid reflux and heartburn require alkaline nutrients to provide relief. These 4 natural remedies, when prepared properly, will give you the relief you need from these conditions. Try them, you will be surprised on how well they work. Do you suffer from acid reflux and heartburn? Does that cup of morning coffee cause you pain and suffering? Are you frustrated when an evening dinner out with friends ends in discomfort instead of relaxed conversation? Do you carry and take antacids every day? Heartburn is a lot more than a mere nuisance. It can detract from enjoying a good meal and force you to change your routine. It dictates your every decision, what you can eat, what you can drink, when you need to lay down. What is this vexing problem and how can you find relief? What causes heartburn? Heartburn occurs when stomach acid makes its way back into the esophagus. A burning sensation and bitter taste are commonly experienced by heartburn sufferers. If you are suffering more than a couple of times each week, you may have the more serious problem of acid reflux disease, also known as GERD, gastroesophageal reflux disease. Not all heartburn is caused by GERD. Occasional heartburn can be caused by many different factors. However, if you have regular episodes, there are a number of things you can do to help. What should you do? If you have regular heartburn, the first thing you should do is stop regularly using antacids. Antacids can alleviate the pain of occasional heartburn, but because they are designed to neutralize the acids in your stomach, they can cause the stomach to create even more acid, a vicious cycle called acid rebound. Also, some antacids cause diarrhea or constipation. Avoid heartburn-triggering foods such as caffeine, chocolate, alcohol, citrus, spicy or tomato-based foods as well as fatty or fried foods, onions or garlic. Smoking or being overweight also increases the risk of GERD. Lifestyle changes may help to control the symptoms. Activities such as lying down after a meal, bending forward, lifting heavy items or eating large meals can cause the onset of acid reflux. Avoiding these activities after a meal and eating smaller portions may help. A few natural products such as extract of orange peel are being researched for their abilities to curb heartburn. WHO is at risk for GERD? Anyone. But it should be noted that pregnant women, the overweight and smokers are all good candidates. Additionally, young babies have immature digestive systems, so they may be prone to GERD. Precautions like frequent burping and keeping the infant upright for 30 minutes after eating can minimize the occurrence. Older children may have to take precautions in diet and activity just as adults do. You should always consult your physician when you suspect GERD, just to avoid future complications. If you suspect GERD, contact your doctor right away. There can be harmful side effects of persistent heartburn including scarring of the esophagus, erosion of the teeth and even an increased risk of esophageal cancer. Frequent, persistent heartburn can also be a symptom of other serious conditions and should be checked on by a physician. Effective dietary tips for acid reflux treatment or heartburn. Dietary tips in acid reflux treatment. When you think about acid reflux, what do you think of first? Which aspects of acid reflux are important, which are essential, and which ones can you take or leave? You be the judge. In cases of persistent heartburn, dietary improvements tends not to be enough alone. So as well as advocating a digestion-friendly diet, your doctor is likely to recommend one or more of the following types of medication. Antacids to neutralize the acid in your stomach, H2 blockers or proton pump inhibitors to reduce acid production, or prokinetics to strengthen the lower esophageal sphincter and expedite stomach emptying. However, if heartburn symptoms are mild and occur only from time to time, usually you will be advised to make the following changes to your diet. Obesity, especially excess fat on the chest and abdomen, is a common contributory factor to GERD and hiatal hernia, and therefore to heartburn. Choose a healthy calorie-controlled diet and customize it by following the eating tips below. Both these factors lead to an increased risk of heartburn. So opt for 4 to 6 small meals or snacks, and allow a maximum of 3 hours between eating. It seems like new information is discovered about something every day. And the topic of acid reflux is no exception. Keep reading to get more fresh news about acid reflux. In addition, choose foods that are easier on the stomach and more easily digested. Fizzy or carbonated soft drinks cause belching and upward pressure on the lower esophageal sphincter, increasing the likelihood of heartburn. The best drinks include water, herbal teas or diluted non-citrus fruit juices. Also note that some soft drinks, e.g. cocoa, coffee, orange juice, are not helpful for heartburn as they can over-relax the thus encouraging the backward flow of acid from the stomach. Constipation can lead to extra strain on abdominal muscles and increase the risk of heartburn. To prevent constipation, eat more high-fiber foods such as oats, apples, pears, dried apricots and vegetables. When increasing fiber intake, it's also important to increase your water intake by at least 40 fluid ounces a day, 4 to 6 cups daily. Alcohol is not helpful to heartburn for several reasons, as it tends to irritate mucous membranes. Now you can understand why there's a growing interest in acid reflux. When people start looking for more information about acid reflux, you'll be in a position to meet their needs. Infants and acid reflux. Facebook, Twitter. Partager. Infant acid reflux is quite common. People of all ages, especially infants because they consume only liquids or soft foods, suffer from mild heartburn or acidic regurgitation on occasion. As in adult cases, infants experience acid reflux when the lower esophageal sphincter is relaxed. The LES acts as a valve between the esophagus and the stomach. It opens up to allow food into the stomach and then closes in order to protect the esophagus and other organs from acidic reflux. Unfortunately, it is difficult to determine if an infant has developed a chronic form of heartburn called gastroesophageal reflux disease or GERD. In order to determine if an infant has a chronic form of heartburn (GERD), you should consult your pediatrician. Look for clues such as sleeping problems, coughing, weight loss, lack of appetite, spitting up frequently, and apnea. Acid reflux disease can cause respiratory problems including pneumonia, strictures and ulcerations on the esophageal wall, and malnourishment. Infant acid reflux symptoms usually include recurrent coughing, bad breath, spitting up frequently, unusual irritability and crying, chest pain, and sore throat. There are several causes of acid reflux in infants. Many of the causes are exacerbated by the fact that infants, much more so than adults, consume mostly liquids and spend a great deal of time on their backs or in a supine position. Combined with the backwash potential of liquids, lying down puts pressure on the esophagus valve and increases the chances for reflux. Other causes could be attributed to the anatomy of a child's stomach position, poor eating habits, smoking, second-hand, being overweight, and food allergies. In addition to GERD, infants can be diagnosed with a functional version of acid reflux. This condition can be improved with simple modifications such as changing eating habits, keeping the child upright after eating, and encouragement. GERD, or the chronic disease, requires medical treatment by a physician, prescription